Right. Dr. Scott Haydon here at Austin Plastic Surgery Institute, going to talk a little bit about GLP-1s. And so it's kind of a category. There's several drugs, but basically it's glucagon-like peptide. And so what happens with these agents that have been around for over 10 years and studying them is that it's going to mimic what the GLP-1 hormone does to regulate your appetite. It's going to slow your digestion. Basically, you're not going to eat as much. You're not going to take in as many calories. And so your weight is going to go down. People that it originally was specifically designed for were really the morbidly obese people, BMIs of over 30. And those folks too that had type 2 diabetes and kind of pre-diabetic numbers, especially if they had comorbidities like hypertension, sleep apnea, etc. Kind of all the things that I had, which is the reason I got on it, because I was almost like 200 pounds and I'm only like 5'8". So it helped me a lot. I lost about 30 pounds. I've been able to keep it off, and I do not necessarily have to continue to take them for the rest of my life, or there's some people that might, okay? So what does it do? Look how much weight you can lose, 15 to 22%. That's a huge amount. That's getting in close to what we do for bariatric numbers. You can improve blood glucose for people with type 2 diabetes so that your glucose numbers are less. We always talk about it, and you hear people talk about sugar and how it's actually very toxic to the body. It's very inflammatory. The less sugar your body sees, the better your overall health is. So cardiovascular risk is protected. There are less heart attacks. There's less stroke. Therefore, you have more longevity. It also, by having less weight and not being as heavy, you have less of a cancer risk. So semaglutide and tirzepatide are the two that we use the most here. Semaglutide was one of the very first ones that came out. Tirzepatide we kind of shifted to using a little more because you get just a little bit more weight loss. But regardless of which one you choose, the mechanism is very similar. Tirzepatide is going to hit two receptors, and semaglutide is only going to hit one. But you also have to change your lifestyle. You have to do resistance training. You have to do some weightlifting. You have to do exercise. And it doesn't mean that just because you're on this, now you can eat all the crap that you were trying to not eat before, because now all of a sudden, you're not going to gain weight. That's not true. Okay, so what do we need to watch for? Some people will have nausea, vomiting at the very beginning. We start everyone at a low dose. And so it's very common for us. Less than 5% of our patients have any side effects or complications because we don't start people at high doses. You start low and you sort of build them up. There are crazy type of black box warnings about people with medullary thyroid cancers and pancreatic issues and things like that. If your family has things that are historically of medical significance, you can let us know. The honest truth is that we've had hundreds of patients taking these medications and we really just haven't had issues with it. So if you are interested in getting that weight off that you've been concerned about for so long, if you're looking to decrease your risk of heart attack and stroke, if you're looking to have a longer, healthier life, then give us a call at Austin Plastic Surgery Institute and we can help you.